Dr. Google has had a huge impact on us as patients and on healthcare professionals. Patients quite often arrive at appointments loaded with lots of information, and they have already diagnosed themselves on what they think that is their problem based on the symptoms that they're experiencing. I think Dr. Google and related things, reviews, ratings, all sorts of search information, plus information from relatives, friends, advice that's been given, should all be considered in the context of the patient conversation. It's all valid information, and it is part of that conversation that needs to happen. I think the result of Dr. Google, or free access to medical information, really has meant that the patient has forced themselves into the conversation about their own healthcare. And that has changed the dynamic. It's changing the relationship. I know there are a lot of healthcare professionals that are quite resistant to that. I see a lot of complaints from my clients' patients because they don't feel like they're in the conversation enough yet. And I think as a sign of respect, our conversation between the healthcare professional and the patient needs to become two-way, and all of the information and the questions that are brought forward from the patient need to be discussed and determined whether they're valid. People can go to get a copy of my book by going to the URL, which is patientsforlifebook.com.au.